So I've had a few patients recently that have come to see me for second opinions regarding their heel pain. Let me tell you, 80% of cases of heel pain are in fact due to plantar fasciitis, but this leaves the 20% of heel pain cases that can be something else. So this patient was seeing another provider for heel pain, and it was diagnosed as plantar fasciitis. The patient ultimately was instructed to undergo the typical measures to treat plantar fasciitis, such as physical therapy, cortisone injections, orthotics, and some other modalities. Ultimately, this did not lead to resolution of her symptoms. There was no difference. The other provider did order an MRI for more advanced imaging and diagnostic clarity. And here's the weird thing, the MRI showed zero evidence of plantar fasciitis. And here's where the story gets even more interesting. It was recommended that the patient undergo a surgical procedure to treat plantar fasciitis. And again, the MRI did not show any plantar fasciitis. So she had two procedures. The first one was a plantar fasciotomy. This is where the plantar fascia is cut in half. And the second procedure is called a gastrocnemius recession. This is essentially a surgical lengthening of the calf muscle. So there is pain to be expected with the post-op period, but ultimately her pain never got better. She was still at that baseline state months after her surgery. So at this point, she came to see me, and after a thorough review of everything that had been done, a very careful history and physical examination, I didn't diagnose her with plantar fasciitis. You would think that the MRI would, but it turned out that she had something called tarsal tunnel syndrome. So this is similar to carpal tunnel syndrome, but it is the foot and ankle equivalent of this disorder. It has some similar treatments to plantar fasciitis, but is treated completely different from a surgical standpoint. So ultimately, the patient underwent an unnecessary procedure in her foot and her leg. And to get this patient relief, we performed two injections. And for the first time in years, she finally had complete resolution of her symptoms.